Alright guys, welcome back to the channel. In this video we're going to be talking about the Airway Box. The Airway Box is what we use to get our patients intubated. There's also some other stuff in here besides what you need for intubation that I'd like to go over. But to start off, we have two Airway Boxes on each side of our ICU. One is always going to be on the crash cart and another is going to be in the medication room. So if you don't have one on the crash cart, go to the one in the med room. Either way, we send these Airway Boxes when they're opened back to Central Supply. So I'll also go over how to use that, but we'll just dive into what is in this box. So there's trackers on all the boxes. So if you need to find one, you can go through the tracking system to find that. But there's always going to be a bunch in CS. Once you open your box, you're going to have a few things. There's this little drawer of things that are in the top, but we'll put this to the side. So in your Airway Boxes, you're going to have oral airways. So if for whatever reason you need an oral airway, maybe it's on a post-op patient that's coming back and they're not setting well, even on a cannula or the Veni mask or whatever, you can come in here and get the oral airways. There's various sizes, so that'll be in there. Also in the top, you're going to have your tongue depressors, some lubricant, some tape for your ET tubes, and then under this, you're going to have all of the blades. So depending on your physician, a majority of the time, we're going to use a specific kind of blade, but you don't necessarily need to know that. It's more necessary for RTs. So you're going to have all your kinds of blades. This one was just used on somebody, so the handle is not in here, but essentially you would just need the handle and the blade, and you could connect the blade to the handle, and then you're going to have what your physician needs in order to visualize the airway. So you have your blade and your handle. Under that, you're going to have all your tubes. So you have different tube sizes ranging from 6 all the way over to a 9. We typically use a 7.5 for women and an 8 for a male, so that's nice to know. In addition to that, you're going to have a stylet. So these stylets are completely disposable. So if you use this stylet, then you can throw this in the trash, as well as your handle and your blade. These are all disposable. So once you use those, you can throw those in the trash. The stylet that is not disposable is the one that you use on the glidoscope. If you have never used your glidoscope or you have more questions on that, you can go watch our glidoscope video, which I'll leave in the description box. Under that, you're going to have masks and scissors. Finally, what's going to be left in your Airway Box is this paper slip. So this slip, basically what it has is all the things that are in your Airway Box, in addition to when they expire. So if I use this Airway Box on my patient, my responsibility as the nurse is to take a patient label and put it here. And then I'm also going to sign my name, and I'll write my name here and put that I'm an RN, put the date, and then you'll take this slip with the label on it, you'll put it in your box, close up your box, and return it to CS. So if you're on night shift, CS is going to be closed because it closes at 4 p.m. So if it's outside of that period of time, then you would call your house supervisor to open up CS and then just drop this off and make sure to grab another one. If you ever need to know the number, then it's here on the side. So this is box 13. So that is your Airway Box. That's everything that's in there. That's how to take it and what you need to do as far as when you use it. And that's it. So if you have any questions, you can reach out or put them in the comments. And that is all. I'll see you in the next video.